Good morning, Mrs. Smith.
Yes.
Say, my name is Pony. I'm going to be a nurse today. How are you doing this morning?
Good.
Okay. So I'm going to be administering your morning meds, but first I have to do hand hygiene, okay?
Okay.
So. Okay. So, and Ms. Smith, could you verify your name and your date of birth for me?
John Smith, January 1st, 1958.
Okay, thank you. And let me just take a look at your wrist, okay, so I can verify. Okay, so the armband matches. Okay. So, Mrs. Smith, you have a few medications that I have to administer this morning. So some of those medications you have to take 2 times today, but I'm going to do the morning administration now, okay? And then 12 hours later, we're going to come back and then we are going to do the second dose of your medicines, okay? So for the list of medicines here, your doctor has ordered Coumadin, which is 10 milligram by mouth. So that medication is a blood thinner, so it's going to prevent you from forming blood clots, okay? And then he ordered a Lipressor, which is 25 milligrams by mouth, and that is a blood pressure medicine, so help keep your blood pressure in normal range. And the doctor also ordered the Digoxin 0.25, and that is by mouth, and that one is going to be administered twice today. So you're going to be given 1 dose this morning and the other dose 12 hours later, okay? And then the doctor also ordered the Doxycycline, which is 100 milligrams, and that is by mouth, and that is for an infection because you do have a UTI, and we have to treat that while you're here today. So that is one of the other medicines that are going to be 2 times. So I'm going to administer your morning meds, and then the other dose is going to be administered 12 hours later. And then also I do have a natural derm patch. So that's a patch that is going to help keep your blood vessels open, to kind of help your heart pump better. And the Digoxin also is going to be for your heart failure, okay? And before I administer these medications, there are some educations I will have to, let you know about. So all of those meds, they can have some side effects, multiple side effects from those medicines. So just watch for any kind of dizziness. If you were to become, lightheaded or dizzy, feeling as if you're going to faint or pass out. If you have any kind of nausea or, any kind of stomach issues, just kind of a weakness, just let us know, okay? So you have your call bell right there. If you need any assistance while we're not in here, just use that call bell and we will come and assist, okay? So I'm going to go ahead and check a few things before I administer the medications the doctor has ordered, okay? So I'm going to go ahead and check your blood pressure. Okay, I'm going to borrow your arm here. So, all right. Okay, your blood pressure is 140/90. Okay. And I'm going to go ahead and I'm going to go and check your heart rate here also, okay? Okay. And your heart rate is 92, okay? All right. And did you use the restroom this morning?
Yes, at 7 o'clock.
Okay, and you left the urine sample in the bathroom?
Yes.
Okay, did you have bowel movement also?
Yes, at 7 o'clock.
Okay, gotcha. So I'm gonna have you to sit up. I'm gonna listen to your heart and I'm gonna listen to your lungs, okay? Breathe in, out, in, out, in, out, in, out, in, out, in. And I'm gonna go ahead and I will listen to your lungs. So take a couple of deep breaths in, out, in, out, in, out. Okay. All right. So everything sounds good. All right. So I'm gonna go ahead and raise your shirt so I can inspect and listen to your bowels. Okay. All right. Okay. I'm gonna go ahead and take a listen. Okay.
Okay.
I'm sorry. This is gonna be cold. Okay. Everything sounds normal. So I'm gonna go ahead, I'm gonna to feel around, okay? So if anything were to hurt or become tender, just let me know, okay?
Okay.
I'm gonna go in slow motion just to feel around, okay? Alright. Where everything feels good. Okay. Alright. Alright. So let me just get your medicines here, okay? So, first medicine to be administered will be the Coumadin. Okay. So I have, so the doctor orders 10 milligrams of Coumadin. Okay. Got it. Okay. And then the next medicine is the Lopressor, 25 milligrams. Lopressor. And then the next meds, Digoxin, 100. And Dicycline. All right, Mrs. Smith, so here's your water. I give you your water here. And medicines. All right, you finished? Thank you. All right. So I'm gonna go ahead and I'm gonna administer the natural patch, okay? Okay, good morning. First, I'm gonna put it on your arm here, so I'm gonna clean, okay? Okay, so there's your patch. Okay. Now after I administer your meds, I'm going to go ahead and put this in the appropriate recycle or disposal bin. And I'm going to do my hand hygiene. Alright. So do you have any questions about anything today?
No.
Mrs. Smith, and just kind of keep in mind, okay, because these medications can cause, a few reactions. So if your stomach were to feel a little, upset, or you start to get real dizzy. you start to feel your heart beating really fast, just use the call bell to call us, okay? And if you need help getting to the restroom, use the call bell so we can come and assist you, okay?
Okay.
And I'm gonna be back in about an hour to reassess. So recheck your blood pressure and recheck your other vital signs and your heart rate, okay? And just to find out, I'll check on you to see how you're doing, okay? All right, well, thank you. Is there anything else I can do for you before I leave?
No.
Okay, so if you have any questions, just use the call bell, okay?
Yeah.
All right, I'll come back and check you in an hour.
Okay.
All right, well, you have a good day. I'm just gonna go ahead and finish my documentations, okay?
Okay.
All right.